One of the major contributors to population aging in China is the low fertility rate. We know that China's total fertility rate, which is measured by the average number of children a woman bears in her lifetime, is as low as 1.4, which is even lower than many of the developed countries. And of course, the draconian one-child policy has been a major contributor to the decline of the low fertility rate. So in order to make the population change more manageable and more stable, China needs to raise its fertility level. So in that sense, abolishing the one-child limit is an important step in the right direction. But the policy change alone is not going to take effect and bring relief to the population aging problem until 2035, that is 20 years from now. And also, the cost of raising more than one child today can be too great for most families in China, especially those in the urban areas. We know that in the countryside, because a de facto two-child policy has already been in place for some years, so the impact of the policy change is not going to be very big. So in a nutshell, abolishing the one-child policy alone won't fundamentally change China's demographic landscape in decades to come. And a more effective policy needs to combine the policy relaxation with other pronatalist changes, such as offering benefits, including education allowance, to couples with more than one child. And also, in order to lessen the burden of raising additional children, it is essential for China to put in place a well-developed social safety net that provides employment insurance, social security, universal health coverage, public sector pensions, etc. Well, if we look at the root causes of population aging in China, it's essentially the same as in elsewhere, that is the low fertility rate and the rising average life expectancy. So China can learn from other countries' experience in coping with the social and economic consequences of population aging. In general, these policy measures seek to raise the retirement age, encourage higher savings, increase the labor force participation, especially by women, and liberalize immigration, and give more incentives for education. And in that sense, Japan can be a very good example for countries who want to handle the challenges of population aging. Well, it is the world's most aged society, with over a quarter of its citizens aged over 65. Although it does not have immigration-friendly policy, it achieved universal health coverage in 1961 when the country was still relatively poor. It implemented long-term care insurance in 2000, despite government budget constraints and a rising health care and social care cost. And these measures have made a real difference in ensuring equitable access to health and long-term care services for all of its population. And today's older generation in Japan is now benefiting from these early reform measures. And in addition, a new concept is being developed in Japan to create the opportunities for the next generation, that is, healthy aging. Under this new concept, health in older persons is not just about presence or absence of disease. It is also about their ability to function well and meaningfully within the context that they live in. So Japan's case reminds us the managing demographic transition to an aged society is challenging, but can also be rewarding in terms of the improvement of health and well-being. In order to mitigate the negative social and economic impacts of population aging, China has to make some painful but necessary adjustments in its economic model. The government now is drafting plans to change the legal age of retirement to 65 years old by 2045. And its current mandatory retirement age compared with other countries is just too low, 60 years old for men and 50 years old for women. And also, since China's savings are already very high, it is unlikely to seek a higher savings rate. But it could attempt to redirect some of the household, societal, and private sector savings toward secure instruments to fund future retirement, something like the 401k plan in the United States. But more needs to be done here. China needs to boost its productivity by making significant investment in health, education, and training programs. This also involves encouraging women, especially urban women, participation in labor force. Entrenched gender discrimination discourages women in China to stay in the workforce until, even though they are still very young. Indeed, women aged over 35 who had a child usually have no luck getting rehired. So to address the problem of entrenched gender discrimination, new laws should be introduced and enacted against discrimination against women in hiring and pay. Population aging in the context of declining fertility shrinks the percentage of people in the workforce and impedes growth. In the past 3 decades, China's seemingly unlimited supply of cheap labor has played a key role in supporting China's extensive growth. But now, China is poised to cross the so-called Lewis turning point. This is a juncture where it would move from a vast supply of low-cost workers to a labor shortage economy. It is forecast that between 2010 and 2050, China's labor force will shrink from 940 million to 710 million. So labor shortage, why this is bad? Because it pushes up the wage level, making China less competitive, especially in labor-intensive industries. It also makes it imperative for China to upgrade its industrial structure to capital or technology-intensive industries, for which China is still not ready. So China will soon lose its advantages of backwardness, to borrow Alexander Gerschenkron, and this is likely going to happen between 2020 and 2025, although the rising labor cost is already slowing down China's economic engine. And by contrast, if we compare China with India, India has 356 million people aged between 10 and 24-year-olds. It is now the world's largest youth population, and China trails second with 269 million young people. And that gap is enlarging given the fertility gap between the two countries. India has a total fertility rate of 2.5, which is much larger than China's 1.4. So supply of abundant labor in the most productive age will keep the wage level low in India and increase India's competitive age and ensure its robust economic growth to be sustained in many years to come. So in that sense, population aging could affect China's international competitiveness and could be the very factor contributing to the shifting balance of power between China and India, if power is measured in terms of gross domestic product size. Older population could have profound implications for China's future healthcare and welfare policies. For example, it leads to significant increase in the number of people suffering from non-communicable diseases, including cancer, cardiovascular diseases, diabetes, etc. About 50% of the non-communicable diseases occur among people aged over 65, and it's reported that by 2030 there will be more dementia, i.e. Alzheimer's disease cases in China than in all developed countries combined. A significant proportion of the elderly population in China is also disabled. According to a 2010 survey, approximately 23% of elderly people in China cannot take care of themselves. So that means more money has to be spent on healthcare. Our research already shows that the per capita healthcare spending for elderly people is 3 to 4 times of the young people. This will be a huge burden for China's healthcare system. So the health sector services priority might have to shift from infectious disease to non-communicable diseases, from treatment to disease prevention and health management. And rapid population aging also leads to drastic changes in ratios between young and old populations and increase the social burdens of supporting older populations. The rising age dependency ratio is going to drive changes in the country's healthcare and welfare system. Beneficiaries may have to accept lower wage benefits. Workers may have to work longer, if not harder, and tax level may have to be increased. So ultimately, aging will change the societal intergenerational relationships, pitting those economically productive young people against those who are benefiting from the social security and medical care payments. A confrontation between workers and retirees will likely arise in China that will polarize the country's society along age lines.